Hi, I'm Dr. Tulika. Welcome to my YouTube channel. Now, let's learn about some cardiac conditions, and today's topic is ACS. ACS means acute coronary syndrome. These ACS means patient may have unstable angina, patient may have non-ST elevated MI or ST elevated MI. So, the clinical features in these the patient usually presents are chest pain, dyspnea, epigastric discomfort, diaphoresis, pale skin, sinus, tachycardia. In chest pain is usually a new onset pain that happened within less than 2 months, that may be a rest pain and crescendo pain. Crescendo pain means pain's intensity and frequency keeps on increasing. Now let's approach for the ACS. For ACS approach, we first do ECG. That should be done within 10 minutes and look for any ST elevation or any kind of ST depression. Second thing we do is imaging. In imaging, we do 2D echo, which is a kind of transthoracic echo. This transthoracic echo shows us new regional wall abnormality. And the third thing is cardio biomarkers for cardiac injury. Examples are troponin, troponin I, and troponin T. Next is myoglobin and etc. Let's learn cardiobiomarkers in detail. So, cardiac biomarkers. First thing is troponin because it's most sensitive and specific. Types of troponins are troponin I and troponin T. Troponin I is much important than troponin T. Next biomarker are early biomarkers. These biomarkers rise within 30 minutes but are not specific. Examples of these biomarkers are myoglobin, HFABP, hard fatty acid binding protein, and third one is IMA, which is the earliest, and it is known as ischemic modified albumin. Third is CKMB. CKMB comes to the baseline within less than 48 to 72 hours, and and it is a marker of reinfarction. Fourth one is LDH. Normally in blood, LDH2 is more common than LDH1, but in LDH flip, or we can say in MI, LDH1 becomes more than LDH2, and this condition is known as LDH flip. Now let's learn about some treatment of ACS. In ECG, is there any ST elevated or no ST elevation? ST elevated means STEMI. Then look for chest pain duration. If the chest pain duration is less than 12 hours, then do reperfusion by lysis within 30 minutes, or you can do primary PCI within 90 minutes. If the chest pain duration is more than 12 hours, then give the drug that is learned by a mnemonic Mona BC. M for morphines, O for oxygen only if SpO2 is less than 94% or shortness of breath present. N for nitrates, to decrease preload. A for anticoagulants, B for beta blockers, to decrease myocardial O2 consumption, and C for anticoagulation. After this Mona BC, we have to do coronary artery angiogram within 24 hours. Now let's learn if no ST elevation. ECG showing no ST elevation. ST elevation. Then look any high risk or no high risk patient. High risk patient or low risk patient. For high risk patient, we have to look for patient's clinical features, troponin levels, and echo. Low risk patient, we have to do serial ECG and biomarkers. If patient develops high risk features, then follow Mona BC, and high risk feature should also be treated by Mona BC. Now let's learn about the anticoagulants that we use. First thing is unfractionated heparin. This unfractionated heparin is given if planning for PCI in less than 48 hours. We can use this unfractionated heparin in STE elevated MI or in patient with renal failure. Because these unfractionated heparin are metabolized by macrophages. These are these unfractionated heparins are given via bolus dose or continuous IV infusions. With unfractionated heparin, we also have to monitor by APTT and activated antithrombin 3. Special point about this is its antidote is protamine sulfate. Now let's move to our second anticoagulant, low molecular weight heparin. Its example is enoxaparin, that is given 1 mg per kg subcutaneously BD. This drug is given if PCI is not planned in less than 48 hours. This is used in non-ST elevated MI. Third drug is fondaparin. This drug is given if not doing PCI. Used in STE elevated MI with HIT, that is heparin induced thrombocytopenia. This drug has the longest acting half-life. So its half-life is 17 hours. Fourth drug is bivalfredin. This drug is used during PCI, used in condition STE elevated MI with HIT, that is heparin induced thrombocytopenia. Its T half is very short, that is 3 minutes. That's the reason we use this drug during PCI. It is also safe in renal failure patients with history of HIT, and this is given via continuous IV infusion. So this is for the today's topic, acute coronary syndrome. I hope you like this. Thank you.